get you a health roundup for today because researchers may be one step closer to figuring out how autism affects the brain. This is a new landmark study. A team linked the disorder to specific cells that helps regulate how signals are sent throughout your brain. So joining me now to discuss this and more, Dr. Daria Long. Of course, we know the brain has hard wiring of all sorts. How does it differ for those who have autism than someone who doesn't?
That's a really good question, Lynn. And this was an early study. They looked at mouse and human brains, and they looked at some of the wiring, and it's just like you have insulation in your house. The insulation of these nerves was damaged, and they think that may be part of a genetic component and cause of autism.
So maybe helps in the treatment
solutions
they can target
coming
new
down
treatments
the road.
For it, this next story, we have, my mom has been saying this for so long, don't do baby talk, like woo, 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 wah, 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 goo, goo, goo. Well, this is because apparently it's not doing the baby any good. There's a new study that says talking to your baby like this is not as beneficial. Actually, you should talk to them like an adult. So my mom always said, don't say baba, say bottle. And I follow whatever my mom says. So I'm like, here's your bottle. He's looking at me like I'm crazy, but why
well, you are doing exactly what's right. So they say parent ease. And what I love about this is that studies have shown that it doesn't matter what a parent's income, education level, socioeconomic status, anything, that what determines a child's economic success is the quality and quantity of words you use in the home in those first 3 years.
Wow.
So when I tell all parents, just talk to your children. Use your normal language, but what parentese is, it's a little higher pitched. It's what you just did, which was enunciating bottle and exaggerating sounds, because kids are listening and they are absorbing and they're learning that future speech in those, especially that first year, is so important.
It shocked me how much they understand as well. I mean, I have a 15-month-old and I'm like, do you want a banana? And he's like, I mean, they really get it. At what age does that really click in?
7 or 8 months even.
Amazing.
And what they found on brain scans, the listening part is lighting up, but also their future speech part is lighting up. They are just absorbing what they're going to be saying, especially when they're teenagers. This is prepping them for that, so you're welcome.
Hopefully. I need all the help in that department with 2 boys. Okay, we've all heard about the warning signs, also real accounts from women who have experienced postpartum depression. But did you know that 1 out of every 5 mothers experience some form of postpartum depression? 20%. There's symptoms that range from anxiety to bipolar disorder to OCD. It's an issue that actually New York City is now tackling head on. It's a new program that will provide first-time parents with up to 6 at-home visits from mental health professionals. I have been saying this for so long. We get 1 million doctor's appointments when we're pregnant. We get 1 checkup at 6 weeks, and I was never asked the question, are you okay?
Right, it's so true. And I've talked to many of my patients. They'll be doing those surveys, and a lot of them say, you know, I answered no because I wasn't as bad. I didn't think I qualified. So yes, 1 in 5 have postpartum depression. 80% of new moms say they have some sort of baby blues. So this happens to everybody. And I think the most important thing from today is that there is no correlation with what kind of mama you are at all. So it's important that moms, but their loved ones, know the signs. I see them on the board of postpartum depression, so that you can do 2 things. One is get everybody support, because those first few weeks, I know for me with my first child, I was going to be super mom. I was going to do everything, and around 5 weeks, reality hit, and it was hard. So get support, just somebody to help out, and then it's okay if you need help. Talk to your doctor, talk to your pediatrician, call one of the helplines.
You know, I think that number 1 in 5 is way underreported, especially for the exact reason that you say, is that women don't know how to identify the signs, or they feel like, wait, it can't be this. I know from my own personal experience, especially with my first, I was definitely going through something. I didn't know how to identify it. I also didn't know how to ask for that help. This is great that New York City is doing this, but what about other places? I mean, it's so essential because there are so many women suffering from it.
Yes, I would love to see this spread, but I hope, again, that what this does is it just opens up people's eyes so that everybody, whatever town you are in, you learn the signs, your loved ones learn the signs. And if you're a loved one and your spouse or friend is experiencing this, lean in. Let's see what you can do to help them. If it's just giving them a couple hours of sleep. I remember in residency crying for no reason, and my residency director saying sleep deprivation is a form of torture. So we as moms and new parents need to cut ourselves a little bit of a break. Get help. Get sleep. It's totally fine.
Something I do now on the other side is a lot of my new mom friends, I'll just send them a text. Just like, how are you doing? It's okay. You don't have to sugarcoat it. Do you need anything? I think that also goes a long way for so many women. And you know, this is such an important topic. Dr. Daria, thanks for being with us, that we actually want to look at this program a little deeper. In my next hour, I'm going to be joined with a man who knows all too well why this program is needed. This is coming up. Well, you can check out more stories from drdaria.com. Thanks for being with us. We appreciate it.